Question 1. Which nursing action best minimizes cross-contamination during medication administration? A. Wearing gloves while preparing all medications. B. Using unit dose medications and avoiding contact with surfaces. C. Administering oral meds before injections. D. Preparing all patient meds in the medication room at once. Answer. B. Using unit dose medications and avoiding contact with surfaces. Question 2. A nurse is caring for a client on airborne precautions. Which action violates protocol? A. Wearing an N95 respirator. B. Keeping the door closed at all times. C. Allowing the client to ambulate in the hallway with a mask. D. Placing a surgical mask on the client during transport. Answer. C. Allowing the client to ambulate in the hallway with a mask. Question 3. Which infection control action is most appropriate when providing oral care to an unconscious patient? A. Use sterile gloves. B. Place the patient in a flat supine position. C. Use clean gloves and turn the patient to the side. D. Wear a gown and surgical mask. Answer. C. Use clean gloves and turn the patient to the side. Question 4. The nurse delegates hygiene care for a patient with VRE to a UAP. What instruction is most important? A. Change gloves between tasks. B. Report any changes in vital signs. C. Use alcohol-based sanitizer when done. D. Wear a surgical mask while in the room. Answer. A. Change gloves between tasks. Question 5. Which statement by a nurse about infection prevention requires follow-up? A. I discard gloves after contact with body fluids. B. I always recap used needles to prevent needle sticks. C. I remove PPE before leaving the room. D. I clean shared equipment between patients. Answer. B. I always recap used needles to prevent needle sticks. Question 6. Which action is inappropriate when handling linens of a patient with contact precautions? A. Hold linens away from your body. B. Roll dirty linens inward. C. Place dirty linens on a chair before disposal. D. Dispose of linens in a designated hamper inside the room. Answer. C. Place dirty linens on a chair before disposal. Question 7. What is the most effective method for preventing the spread of hospital-acquired infections? A. Double gloving during sterile procedures. B. Routine surveillance cultures. C. Consistent hand hygiene practices. D. Using private rooms for all patients. Answer. C. Consistent hand hygiene practices. Question 8. The nurse is preparing to care for a patient with rubella. What type of precautions are necessary? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Protective isolation. Answer. B. Droplet precautions. Question 9. Which nursing task is appropriate to delegate to a UAP for a patient with hepatitis A? A. Emptying a bedpan while wearing gloves. B. Administering oral fluids. C. Assessing for jaundice. D. Teaching hygiene measures. Answer. A. Emptying a bedpan while wearing gloves. Question 10. Which action reduces the risk of ventilator-associated pneumonia, VAP? A. Providing oral care with sterile water. B. Keeping the head of bed flat. C. Suctioning only when secretions are visible. D. Elevating the head of bed to 30 to 45 degrees. Answer. D. Elevating the head of bed to 30 to 45 degrees. Question 11. A nurse is preparing to administer an injection. What is the correct method to clean the vial? A. Wipe with dry gauze. B. Rinse under running water. C. Wipe with alcohol swab and let dry. D. Use sterile gloves before touching the vial. Answer. C. Wipe with alcohol swab and let dry. Question 12. A client with meningococcal meningitis is admitted. What is the nurse's immediate action? A. Place on airborne precautions. B. Start standard precautions only. C. Implement droplet precautions. D. Prepare to discharge contacts. Answer. C. Implement droplet precautions. Question 13. Which practice should the nurse avoid to prevent the spread of pathogens in a multi-patient room? A. Disinfecting stethoscope between uses. B. Using hand sanitizer before gloving. C. Placing used equipment on a shared bedside table. D. Performing hand hygiene after glove removal. Answer. C. Placing used equipment on a shared bedside table. Question 14. Which intervention is best to prevent bloodstream infections from 4 catheters? A. Change dressings every 5 days, regardless of condition. B. Use clean gloves to handle insertion sites. C. Scrub the hub before access. D. Flush catheters hourly. Answer. C. Scrub the hub before access. Question 15. A nurse is caring for a client with herpes zoster. Which roommate would be most appropriate? A. A patient with chickenpox. B. A patient post-hip replacement. C. A patient recovering from measles. D. A patient with prior varicella exposure. Answer. D. A patient with prior varicella exposure. Question 16. What action by the nurse helps prevent transmission of conjunctivitis in pediatric clients? A. Encouraging hand washing before meals. B. Using gloves for all patient contact. C. Teaching children to use tissue when sneezing. D. Avoiding shared linens and towels. Answer. D. Avoiding shared linens and towels. Question 17. Which behavior by a nurse caring for an isolated patient shows proper infection control? A. Wearing gloves only for wound care. B. Reusing gowns for repeated visits. C. Removing PPE before exiting the room. D. Wearing a mask under the chin when not in use. Answer. C. Removing PPE before exiting the room. Question 18. A nurse is performing a wound irrigation. Which technique prevents splash exposure? A. Irrigating with high-pressure syringe. B. Wearing goggles and face shield. C. Holding wound below waist level. D. Standing close to the wound site. Answer. B. Wearing goggles and face shield. Question 19. Which PPE is required when cleaning up a blood spill in a hallway? A. Gloves and mask. B. Gown and face shield. C. Gloves only. D. Gloves, gown, and face shield. Answer. D. Gloves, gown, and face shield. Question 20. The nurse educator teaches students about infection transmission. Which statement indicates understanding? A. Airborne pathogens require surgical masks. B. Contact precautions are used for measles. C. Droplet precautions require a private room and mask. D. Gloves aren't needed if hands are washed well. Answer. C. Droplet precautions require a private room and mask. Question 21. Which nursing intervention best prevents infection when providing perineal care for a female patient? A. Cleanse from anus to urethra. B. Use one wipe for the entire area. C. Cleanse from front to back. D. Dry using the same towel used on the face. Answer. C. Cleanse from front to back. Question 22. Which type of precaution is required when caring for a patient with disseminated herpes zoster? A. Standard precautions. B. Contact and airborne precautions. C. Contact and droplet precautions. D. Droplet precautions only. Answer. B. Contact and airborne precautions. Question 23. What is the most appropriate nursing action after removing PPE? A. Discarding gloves before the gown. B. Performing hand hygiene immediately. C. Removing the mask first. D. Removing PPE outside the isolation room. Answer: B. Performing hand hygiene immediately. Question 24. The nurse is caring for a patient on contact precautions. Which item should remain inside the room? A. Blood pressure cuff. B. Medication administration record. C. Nurse's personal stethoscope. D. Clipboard with vital signs sheet. Answer: A. Blood pressure cuff. Question 25. A patient with suspected measles is admitted. What should the nurse do first? A. Place the patient in a negative pressure room. B. Apply standard precautions. C. Administer 4 fluids. D. Notify infection control after 24 hours. Answer: A. Place the patient in a negative pressure room. Question 26. Which practice is safest for handling a needle after administering an injection? A. Recap with both hands before disposal. B. Place in a sharps container immediately without recapping. C. Bend the needle before disposal. D. Remove needle and discard separately. Answer: B. Place in a sharps container immediately without recapping. Question 27. When providing care to a patient with a draining abscess due to MRSA, what PPE is essential? A. Gown and gloves. B. Gloves only. C. N95 mask and gown. D. Surgical mask and gloves. Answer: A. Gown and gloves. Question 28. Which patient should be placed in a private room to prevent nosocomial infection spread? A. A patient with pressure ulcers. B. A patient with RSV. C. A patient with a surgical wound. D. A patient with anemia. Answer: B. A patient with RSV. Question 29. A nurse observes a colleague exiting an isolation room without removing shoe covers. What should the nurse do first? A. Report the behavior to management. B. Confront the colleague publicly. C. Remind the colleague to remove shoe covers before exit. D. File an incident report immediately. Answer: C. Remind the colleague to remove shoe covers before exit. Question 30. What instruction should be given to visitors of a patient with C. difficile infection? A. Use alcohol-based sanitizer after visits. B. Wear a surgical mask. C. Wash hands with soap and water before and after visit. D. No precautions are needed. Answer: C. Wash hands with soap and water before and after visit. Question 31. When prioritizing care, which patient should the nurse assess first? A. A post-op patient with a dry dressing. B. A patient with a high fever and neutropenia. C. A patient requiring a wound dressing change. D. A diabetic patient asking for breakfast. Answer: B. A patient with a high fever and neutropenia. Question 32. Which equipment should the nurse use when entering the room of a patient with suspected pertussis? A. Gloves and gown. B. N95 mask and face shield. C. Surgical mask. D. No PPE is necessary. Answer: C. Surgical mask. Question 33. A patient asks why they are in isolation for MRSA. Which nurse response is best? A. It's just a hospital policy. B. You are contagious only when symptoms are visible. C. Isolation helps prevent spreading the bacteria to others. D. Isolation is required for all skin infections. Answer: C. Isolation helps prevent spreading the bacteria to others. Question 34. Which behavior requires correction when donning sterile gloves? A. Opening the package carefully. B. Touching the glove's inner surface with bare hand. C. Holding gloved hands above the waist. D. Keeping gloves above sterile field. Answer: B. Touching the glove's inner surface with bare hand. Question 35. What infection control action should the nurse take when collecting a sputum sample for tuberculosis testing? A. Collect the sample after the patient eats. B. Use a clean glove and mask. C. Have the patient collect the sample in a private, ventilated area. D. Obtain the sample during the afternoon shift. Answer: C. Have the patient collect the sample in a private, ventilated area. Question 36. Which of the following situations poses the greatest risk for healthcare-associated infection? A. A post-surgical patient ambulating in the hallway. B. A patient with an indwelling urinary catheter for 7 days. C. A patient with diabetes receiving insulin. D. A patient recovering from a broken femur. Answer: B. A patient with an indwelling urinary catheter for 7 days. Question 37. Which teaching point is essential for a patient being discharged with a PICC line? A. You can swim with the line as long as it's covered. B. You can lift weights with the affected arm. C. Wash hands before and after touching the line. D. There's no need to check the site daily. Answer: C. Wash hands before and after touching the line. Question 38. When collecting a wound culture, what step must the nurse follow to ensure accuracy? A. Collect pus from the surface. B. Swab after applying antibiotic ointment. C. Clean the wound before collecting the specimen. D. Use a cotton ball dipped in saline. Answer: C. Clean the wound before collecting the specimen. Question 39. A nurse caring for a neutropenic patient should avoid which action? A. Performing hand hygiene frequently. B. Placing a fresh flower vase at the bedside. C. Wearing gloves when handling body fluids. D. Monitoring for fever daily. Answer: B. Placing a fresh flower vase at the bedside. Question 40. What is the nurse's best response when a family member refuses to wear PPE in an isolation room? A. That's okay if you just don't touch anything. B. This is for your safety and to protect other patients. C. We only recommend PPE, not require it. D. Only staff need to wear PPE. Answer: B. This is for your safety and to protect other patients. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!